Hey guys, sorry about that. I think everyone's back. I lost you guys there for a second. When I go live directly through Facebook, it's a very odd settings and it doesn't let me share my screen. And so then sometimes I do it through StreamYard and I'm live, but I can easily share my screen. So hopefully, that cut me off there. I'm sorry about that. But hopefully you guys are on with me again. And if not, I will send this as a recording. It's saying I'm live. So I think I should be live. So in any case, I was talking about having just done my fourth module for my functional medicine program from through IFM, and this one was the hormone advanced practice module. And it's a really intensive one. It's one that I have been waiting for a really long time, especially because it covers both male and female hormones, adrenals, thyroid. It covers all those sections, and truly, I feel that in chronic illness, that is one of the biggest areas that is affected. So, that definitely is a big issue for trying to heal from chronic illness and understanding the workings of the hormones is really key to feeling better. So I was really excited for this module and I took a lot of notes. And I think two people on the group asked the question about me covering this for perimenopause and a little bit about, mold and mycotoxins and how it affects your hormones and things like that. So we're going to cover that. I'm going to share my screen in a minute. It's saying that I'm live, so if you're on and I see there's a couple of people on, if you can just comment or make a little comment so I can see that everyone can see me, I am going to go ahead and share my screen. All right, here we go. Let's share this. This is a little presentation that I made. Okay, so hope you guys can see this. And we are going to be talking about perimenopause today. So what is perimenopause? It's the time in a woman's life when the hormones start declining. Usually it's natural and due to aging, but we're now finding out that there's so many other extraneous circumstances and factors that cause perimenopause. So it lasts from a few years until 12 months after the end of your period. So when you end your period, 12 months from that is when you're basically considered in menopause. Having sporadic periods and cycling on and off, that's still perimenopause. But when you officially have 12 months of your last period, then that takes you into menopause. Perimenopause lasts anywhere from 4 to 8 years, and it can happen anytime from your mid-30s to late 40s. Just like the age to start your menstrual cycle is getting earlier and earlier, I feel like perimenopause is getting earlier and earlier as well, because to me, mid-30s, late 40s is still early, especially my mom's generation and my grandmother and everybody didn't go into menopause until 57, 58. So I feel like it's a little earlier now that we're seeing this. So what are the signs and symptoms? Some of them, and I think most of them are the most obvious ones, but when you have a lot of these together is really when, you can start seeing this. So irregular periods, some people say their cycles are very short, some say they're longer. Definitely I've heard a lot of complaints about heavy bleeding, periods lasting 7 days, sleep problems, not sleeping, waking up a lot at night, mood dysfunction, really, really irritable, vaginal and bladder problems, especially really having to go to the bathroom a lot, things like that, changes in sexual function. Loss of bone is definitely a key one when you get your DEXA scan done. And then changing cholesterol levels, weight gain, headaches, and there's so many more, but these are, joint pain and headaches are now, they're basically saying that's menopause. You're not, having this joint pain. You don't have arthritis. You really have more menopause type symptoms. So all of these things kind of constitute the perimenopause stage, and those are the signs and symptoms. So what are the drivers of hormonal imbalance? So if you're in perimenopause, there is potentially 3 to 4, or actually in this case, 5 things that could potentially be going on. You can't just say it's perimenopause and it's a blanket statement, because everyone has different hormonal imbalances that they can go through. So the first one is, which is one of the most common ones, is estrogen dominance. And estrogen dominance basically means where you have a lot more estrogen relative to progesterone. So either your body is producing too much estrogen, and so your level of estrogen is much higher, or your body is really producing very little progesterone, and so then relative to that, your estrogen level is too high. So that's estrogen dominance. The other one is called luteal phase dysfunction, and this is, when the ovary ovulates and sends this egg out, there is something that gets formed that's called a corpus luteum, and if it doesn't get fertilized, it then just produces progesterone, which breaks down the uterus lining. Its nature is just amazing. If the egg doesn't get fertilized and implanted into the uterus wall, that thick uterine wall that it had formed, to help with the implantation of the egg, or the fertilized egg, then gets broken down because the corpus luteum produces a bunch of progesterone to break that lining down. And so when you don't have that, when you have decreased ovulation, you're not going to have a corpus luteum. And so that means that you are not going to have progesterone, because the progesterone is not being produced by the corpus luteum. But in other cases, you can have decreased progesterone if you're in a very low calorie diet, if you eat very little fat, things like that. You exercise a lot, then all of those things can really, cause decreased progesterone. The third one is fluctuation in hormone levels. So if you have sensitivities, psychological stress, just stresses in your life, you will have a lot of fluctuations during your cycle in your hormone levels. And then the fourth one is hormonal insufficiency. For example, if you've been exposed to mold and Lyme and mycotoxins, or premature aging, and then premature ovarian failure, which is one of the things that I was diagnosed with, but it really is because of, not your body not producing enough hormones. And then suboptimal hormone metabolism, if you drink a lot of alcohol, if you have a poor diet, hormone replacement therapy, endocrine disruptors, etc., all of those things can constitute for suboptimal hormonal metabolism, where you are really not breaking down the hormones. If you have a poor diet, and extra fat and carbs, hormone replacement therapy, you have endocrine disruptors like plastics and xenoestrogens, things like that, you're really not breaking down the hormones that your body is producing. The one thing I learned this weekend, I always knew about the HPA axis, but they've now been calling it the HPA-TG axis, which is the hypothalamus, pituitary, adrenal, thyroid, and gonadal axis. And that really makes sense to me because all of those are tied together. If you've heard me talk about the triangle before, it's like the three legs of the stool. So similarly, now they are putting all of them together to form the HPA-TG axis. And really, you always want to work upstream. So you always want to treat the adrenals first. And it's amazing how when you go to your doctor and you tell them you have all these symptoms, they give you the birth control pill to try and fix the problem. But they're just putting a Band-Aid by giving you extra hormones versus working upstream, and really the adrenals being the cause of all of these imbalances and issues. One of the things that I learned this weekend, and all the instructors really emphasized on this, is how, perimenopause, all hormonal dysfunction, any of this, the things that we go through, men or women, are all related to the adrenals. And so in functional medicine, when a patient first comes to you, instead of treating the hormonal imbalance, they actually go work their way upstream and first start with the adrenals, which I thought was very impressive. Because if you probably look at your own example, my example, anything like that, it was really the adrenals that were very taxed and affected first, after which came a domino effect of everything else. So I thought that was very important. So in perimenopause, of course, one of the big signs is hot flashes. And one of the things that they stressed and emphasized on is that hot flashes do not always correlate to estrogen levels. Giving estrogen is not always the correct treatment. It may be in some cases, but it really is not always the correct treatment. You need to fix their sleep and fix their adrenals to really be able to fix the hot flashes. I thought that was such an aha moment for me, because learning about how important the adrenals are, but women really complain of hot flashes. And then there's some that don't have any hot flashes at all. So if it was truly hormonal related, then everyone should get hot flashes. But there are some women who just breeze by into menopause and don't really have any of these hot flashes and things like that. So that's really fixing the adrenals that would help. So, identify the triggers for the hot flashes. Hypoglycemia is the number one cause, for hot flashes. If your blood sugar levels, go up or down very rapidly, then you are going to have hot flashes because your body's going to produce more cortisol. Adrenal cortisol, if you have a lot of stress, you get very stressed out with a certain situation, it's going to give you hot flashes. Food and drink, including alcohol, will give you hot flashes. Thyroid dysfunction, toxins and mycotoxins, which is something we've talked about, and I know someone wanted me to elaborate on that, and we will a little bit later. And even certain cancers, if you have hormone secreting tumors, then they're going to cause hot flashes. And then certain drugs like hypertension drugs, allergy medications, anxiety medications, things like that will cause hot flashes. So what are the treatment of perimenopausal symptoms? Lower adrenal cortisol. That is the number one thing that you can do to help treat perimenopausal symptoms, is to really decrease the adrenal cortisol, whether it's because of insomnia, because of high stress. If your patient really needs to relax and learn how to do some stress management, you will really see a big difference in their perimenopausal symptoms. Managing blood glucose levels, again, like I said, if you have really high, really low, these spikes up and down, you're going to have a lot of perimenopausal symptoms. And then diet, avoiding excess sugar, excess caffeine, excess alcohol. This weekend in the course, that one of the doctors, she's been an OBGYN for 20 plus years, and she's now a functional medicine doctor, Dr. Warner, and she talked about how, you could do 1 cup of coffee a day, but for those people that are doing 3 and upwards of 4, that's where you really start affecting your adrenals. And then managing estrogen metabolism, really detoxing your body, and having a lot of cruciferous vegetables that are high in fiber. And so what you're doing with that is really helping produce the sulforaphane, which is then going to be used to bind and take that estrogen out of your body. And then treating the gut, always important to treat the gut for any imbalances. Liver, upregulate the liver detox systems, because again, the liver is the number one organ that not only detoxifies, but it also takes out the estrogen. So it's very, very important that your liver channels are open. And using progesterone to treat estrogen dominance is definitely an acceptable method to deal with perimenopausal symptoms. And then decreasing body fat. Most people don't realize this, but fat cells actually produce estrogen. So the more fat that you have around your belly, the more estrogen your body's going to produce and keep you in estrogen dominance. And so really decreasing that body fat, especially abdominal body fat for men and women, is very critical if you wanted to decrease estrogen dominance and manage your perimenopausal symptoms. So men also get estrogen dominance, and it's not just a female thing. And for men, the signs and symptoms are a little different. They have infertility. They have gynecomastia, which is the development of breasts in men, erectile dysfunction. There's weight gain, especially belly weight gain, that you can see with estrogen dominance in males. I've known a few men that have developed gynecomastia, which is, developing breasts. And one of them actually ended up getting breast cancer because of that. And it was a male. So, it's really important with men too to decrease your estrogen dominance. So what are the treatments of estrogen dominance in men? They're very similar to the ones I just talked about in women. So losing the belly fat, it's very, very critical, especially in men. They tend to have more of an abdominal belly. So really losing the belly fat, fat cells produce estrogen. And so you really want to make sure that you decrease belly fat. Diet, you need a low carb and even a low fat diet, but a high fiber diet, because at least 30 grams of fiber per meal will really help keep your gut motility, keep all the toxins out, detoxed, things like that. But then also help break down and carry out that estrogen. And you want to reduce your alcohol. You want to exercise or walk 5 days a week. Intermittent fasting, really good for men to decrease estrogen dominance because you're really balancing your blood sugar levels, and in turn, you're also decreasing your fat cells. And then decreasing insulin resistance is really key because the more insulin that your body produces, the more resistant the fat cells are getting to insulin and storing those fat cells. So you're having more and more estrogen being produced. It's a vicious cycle. So these are some of the ways that you can treat estrogen dominance in men. So real quick, just as you're listening to this talk, it's a lot of information. I just very quickly condensed it. You have to be working with a practitioner to kind of help guide you. And as I mentioned, this is not just like a week or a month process. This is a really, really long process when you get started. But it takes consistency and discipline. So I just wanted to put a few things out here of what you can do immediately if you're having a lot of perimenopausal symptoms, if you're having estrogen dominance symptoms, whether you're a male or a female. Definitely the number one thing is getting away from the source of toxins, or like, if you have mold exposure or things like that. So one of those things is just getting away from that source is very important because it causes a vicious cycle of inflammation and things like that. So you want to get away from the source of toxins. You want to fix your diet, mainly plant-based, high fiber, high cruciferous vegetables. Getting rid of some of the animal products and animal meats will kind of help with balancing some of your hormones. You want a more plant-based diet, but try to eat organic as much as possible. But you really want to be very high in fiber and high in cruciferous vegetables, because again, as I mentioned, those really help to detoxify and take the estrogen out of your body. You really need to get urine or blood hormonal levels tested. And if you need to supplement, you really do need to supplement. I have seen so many posts, not only on my group, but on many other groups. And I'm even part of a hormone replacement group, hormone replacement therapy group, that women are really against hormone replacement therapy. And part of it comes from the Women's Health Initiative, a study that was done years ago. And about 20 years ago, they came out with these results, which today have completely been debunked. You really do need hormone replacement therapy, especially if you're in premature ovarian failure, where your body's producing nothing. Or if you're in menopause and you have estrogen dominance, it can lead to cancer, breast cancer. So you really want to balance that estrogen out with some progesterone. So I know that even on this question where someone had posed, and I don't want to say their name, but they had also said something to the effect of, I don't want to do hormone replacement therapy. Actually, hormone replacement therapy is very, very beneficial, especially if you are working with a practitioner. They have really configured your hormone levels correctly, and then you're working based on that. Not doing hormone replacement therapy, especially things like estrogen and progesterone, can lead to further problems down the road, even testosterone, especially for women. If you don't have estrogen, you can get, osteoporosis, you can get cardiovascular disease, diabetes, and dementia, and all of those things are really a cause of lack of estrogen. And the same thing for men. If you don't have the testosterone, it kind of leads to a lot of these issues and problems. So you really do want to get tested by your practitioner and work with a practitioner to balance your hormones correctly. Especially in my case, I was so young when all of this happened. And so I really had no choice. But you're also going to feel better mentally, emotionally, physically. When your hormones are balanced, you're going to feel better. But then also, of course, like decreasing stress, treating HPA axis dysfunction, working on the vagus nerve. Those are really, really critical because, again, as I said, we learned a lot this weekend, and emphasis was put on the adrenals more than the ovaries or the testes, mainly because of the fact that you work upstream. It's all interconnected, and you want to make sure that you're working, with the adrenals first. And sometimes just helping the adrenals will really quickly help normalize your hormonal levels. So that's very important. And then walking or gentle movement every day if tolerated. I know there's a lot of people on this page that are on the group that are very sick and they cannot. And for those people, we say things like gentle yoga, restorative yoga, things like that. But walking or gentle movement every day, if you can tolerate it, is really, really critical to balance your hormones, to heal, to decrease inflammation, all of the above. So, remember, it's not a quick fix. This will take months of just consistency and discipline and things like that. So that's the only little presentation I had. Let's close this out here. That's the only little presentation that I had for today. Like I said, nobody really asked any questions. And some people asked about me wanting to do this perimenopausal thing. Somebody asked about talking about toxins and hormonal imbalance, which I did in the talk. And somebody talked about not wanting to do BHRT, and I kind of just, touched on that a little bit too. So I hope this helps. Sorry about the little disconnect thing there earlier on, but I hope you guys have an awesome rest of the week, and I will see you next Tuesday with our live Q&A again, 7 p.m. Eastern Standard Time on the group, and I will talk to you guys then. Take care. Bye-bye.